A very warm good morning, and thank you so much for tuning in to Capuchin TV. Now, you are right on time for the Around the Table show with me, Sasha Elizabeth. Well, have you ever asked yourself whether pregnancy can affect your oral system? Well, the response is yes. And that's why today we bring you this live discussion on maternal and perinatal oral care, just to give you a broader perspective of the kind of conditions that are likely to occur, how they occur, and whether or when to see a dentist. With me in studio is Dr. Sam Serimala from Mater Misericordia Hospital. Doctor, welcome to the show.
Thank you for having me.
Please tell us a little bit about yourself and what you do.
My name is Dr. Sam Serimala. I'm the resident dental surgeon at Mater Hospital. I've been practicing for about 5 years post-internship. And today I'm here to talk to you about how to help pregnant women maintain their oral health and to educate them and to help them generally have good oral care, because we at Mater believe it's very important, and it's a program we're trying to initiate in our clinic.
Absolutely, that's very paramount. So now, right now, maternal could be a common word, but what about perinatal? Could you please shed some light on that for those who might not have a clue what it means?
Perinatal basically means the period around pregnancy. So maternal usually refers to the pregnancy period. Perinatal means a few weeks before and after that period.
So the period, okay, thank you so much. So how does, to start off, how does pregnancy affect one's dental health?
That's a good question. How pregnancy affects one's health is, pregnancy causes a lot of changes in the body. It causes changes in the skin, feet, a lot of things. Any pregnant woman can tell you that. But I think most people are not aware that it changes also the oral environment, and it's very important we educate that, because some of the changes it can cause, like physiologically, is the immune system. Okay, it can go into a flux where there's a delayed, well, not really delayed, let me say an interrupted response by the body to oral pathogens, okay, which can lead to decreased antimicrobial activity. Also, the hormone change, okay, it can cause, for example, this is just an example, the hormones cause a lot of changes in the mouth. One of the ones it causes is, it changes how your blood vessels works, okay, which causes increased inflammation, all right, and also allows the bacteria to penetrate easily, leading to inflammation of the gums. All right? Also, what we should be, the ones I've spoken about are physiological, but the ones I should also talk about is also behavioral, okay? Because when you're pregnant women tend to snack, and their eating habits change. So you'll find them snacking, or even if they're not snacking, they take foods which are rich in carbohydrates and sugars, all right? So bacteria love sugars, and they're the ones which usually cause a lot of, so the bacteria, use the sugars to cause cavities and decay, which leads to prevalence of cavities in pregnant women.
Thank you so much. So what are some of these conditions that are likely to occur? And are there any factors or more habits that might make someone more susceptible to getting these conditions?
The most common conditions which pregnant women have is, the first is pregnancy gingivitis, okay? Gingivitis is just an inflammation of the gums. It's the first type of inflammation of the gums, all right? If untreated, or if there was prior gingivitis, it can progress into something we call periodontitis. Periodontitis is now an advanced type of inflammation of the gum, all right? Tooth erosion can occur. Tooth erosion is when the tooth get worn out by acidic foods, okay? This is especially common with morning sickness, where a lot of people, they're vomiting all the time, or even gastric reflux during the third trimester. Dental decay, or what we call caries or cavities in layman's terms, is also very common, like I spoke about earlier, because of the increased sugar uptake. Also, another one is you can get benign oral lesions, okay, such as pyogenic granuloma, okay. These are just inflammations caused by pathogens, and then your body responds in that type of way. And also another one you can get is canker sores, or what we call aphthous ulcers, which are ulcers which you get usually related to stress and also immunity. Yeah.
Thank you so much for that detailed information. So now, how do these oral conditions affect a pregnant woman, and do they affect the unborn child?
Do they affect the unborn child? Vertical transmission is something that's known. Okay, there's a study that has linked periodontitis to to early childbirth, all right, and low birth weight, all right. But for the woman, what it does is it affects her quality of life, all right? A lot of women, I can tell you stories where they suffer through the pain because they don't think the tooth is that important compared to the pregnancy, right? So, but now when they're in pain, okay, they're not eating well, okay? The pain, which is usually caused by an abscess, the abscess can become more advanced, okay, and become now an abscess, all right? Yeah, and even some try to manage the pain with paracetamol, okay, which they take a lot of, and that can be harmful to them if they take too much of the drug. So these conditions do affect them. It's just that they suffer in silence, and we'd like to change that.
Thank you. Is it necessary now for a pregnant mother to visit a dentist?
Is it necessary? Yes, I think so. Okay. Is it a requirement? I think it should be, but it's not currently. But yeah, a pregnant woman should visit a dentist. We can help them manage the oral conditions, all right, and just make their quality of life that much better.
So at what point should they visit the dentist? Should they wait for the telltale signs or symptoms? Or when one conceives, they should just consider seeing a dentist?
They should come for a checkup. Ideally, they should come for a checkup sometime during the like if they're seeing a regular dentist at their 6-month checkup, that's when they should come. But if they're symptomatic, of course, they should come. They should not wait until it becomes an emergency where they're in pain. During the pregnancy period, I think during the first trimester, maybe that's the tentative period where it's a bit hard, okay, because that's when organogenesis is happening for the fetus. So we're a bit hesitant, okay. During the second trimester, that is when it's organogenesis is more or less complete. Organogenesis means that's when the baby's organs are developing. So during the second trimester, it's more or less safe to treat the baby. And during the third trimester, it's also safe to treat the baby. The issue is usually the mother, okay, because due to certain physiological changes in her body, making her lying down for a long time can be very uncomfortable, okay. So, but there are ways we can alleviate that and make it comfortable for her. But generally, a woman who's pregnant should come at any time during the pregnancy period, okay. Of course, talk to their dentist. Discuss with them, then they make the best decisions for themselves. If it's an elective procedure, it can always wait till the second or third trimester. If it's something which can wait for after pregnancy, that can also happen. What is important is they be seen and they be treated according to what they deserve.
Please tell us what dental x-ray entails and whether a pregnant woman can go through dental x-ray during pregnancy.
Yes, the evidence currently says, this is a very sensitive topic, by the way. The textbook evidence says that an x-ray, dental x-rays, not an x-ray, dental x-rays are, specific dental x-rays are safe during pregnancy, okay? But that also, the amount of radiation that is safe depends on, of course, the type and amount, okay? And for a dental x-ray, okay, it's a very, very low dose, okay? It's about 0.01 millirads, okay? A rad is a unit of measurement for an x-ray, okay? And a millirad is 1/1,000 of a rad, okay? So for you, and before I get even to that explanation, the dosage that is considered dangerous for a fetus is 10 rads, okay? And usually, very rarely, most x-rays go above 5, all right? For our dental x-rays, which is 0.01 millirads, you will need 100,000 dental x-rays just to get to 1 rad. So you can see, I don't think there's a way we're going to take 100,000 x-rays. So And also, of course, we do take precautions. We do have shielding for you, for the thyroid and for the fetus. So it's very safe. But again, this is very sensitive, okay? We all know what radiographs can do and x-rays. So it's very dependent on the dentist and the patient, okay? It's them to have a discussion. If it's an emergency, of course it's an emergency. If it's elective, it's for them to decide. Personally, I would not do it in the first trimester, okay? Second and third, I'd also be hesitant unless it's an emergency and it needs.
So at what point is it considered an emergency?
Emergency can mean very many things, but the most common emergency we have is pain, okay? Pain, and a second one, which is maybe not an emergency for most, is when the aesthetics change, all right? People really care about their aesthetics, all right? So those are usually the emergencies we treat, but of course there are others. It's a broad topic.
So now, is it abnormal for a child? I would like us to discuss about a child born with teeth. It's a condition that happens, though very rare. But before that, we are going for a very brief break. Then we'll be back with details. Now, this is a Round the Table show with me, Sasha Elizabeth. We will be back with more details. The topic being maternal and perinatal oral care. Do stay with us.
Jumamosi hii, tarehe 20 Februari, Capuchin TV tutaungana na watawa na wanafunzi wa chuo cha falsafa cha Consolata jijini Nairobi kwenye ibada takatifu ya misa kwenye maadhimisho ya jubilei ya dhahabu ya chuo hicho. Ibada hii itaanza saa 4 asubuhi na kukufikia moja kwa moja kutoka chuo hicho. Ibada hii itaongozwa na mkuu wa shirika la wamisionari wa Consolata hapa nchini, Padre Peter Makau. Capuchin TV tunawapongeza wamisionari wa Consolata hapa nchini kwa kazi zao njema za kitume. Capuchin TV, ni fahari yetu kuunga mkono juhudi za wenzetu.
Welcome back, and thank you for keeping tabs with the Round the Table show. Now, in our first session, we were discussing about maternal and perinatal oral care. And with me in studio is Dr. Sam Seremala. And we heard just about some of the conditions that can occur during pregnancy and some of the factors or other habits that predisposes a pregnant mother to these conditions. So now we move on with the same topic. Now, doctor, please tell us about the elective cases per trimester.
So for elective cases, these are things like, usually they're things like fillings, cleanings, what we call scaling and polishing, and such crowns, okay? So usually we don't want to interrupt with the baby's development, right? So as we know, baby's development is usually divided into 3 trimesters. That's the first, the second, and the third. So the first, it's well, I told you earlier, it's okay to treat during all trimesters, right? But for elective, what the dentist can decide with their patient is during the first trimester, where organogenesis, what I told you, is development of the baby's organ. Because the fetus at this time is highly susceptible to changes, okay, to environmental influences, which can be either intentional or unintentional. It's not a bad idea to hold back the treatment and wait for the second trimester, all right? During the second trimester, where it's more development than new organs occurring, okay? It's relatively very safe, okay, unless there's a medical condition which disallows it. You know, maybe it's a risky pregnancy or something, all right? So you can decide to hold off the treatment. In the third trimester, again, for the baby, it's safe, okay, unless it's something which is very an electively invasive case, all right? Maybe I should also mention, if it's an elective and invasive case, such things as surgical disinfection of wisdom teeth. Of course, those can wait unless they're causing now an emergency condition, okay? So invasive cases, when I talk about elective, I'm not talking about very invasive cases. Invasive cases always tend to wait until they threaten to become an emergency.
Could you please shed some more light on the differences between the
Between?
invasive and elective cases?
Between invasive and elective, okay. Generally, we can say that they're elective and emergency cases. So elective means you decide to do it by your own will, okay? Now, those ones can be a minimal procedure. This is a general classification. It can be a minimal procedure or something complicated, right? So minimal are things like, for us dentists, are like fillings, root canals, scaling and polishing crowns, okay? Those are not things which we expect to cause a lot of harm, okay? Invasive means that you're going to go into tissue, all right? You're going to need, basically there'll be some blood which is produced, if I can be so loose with that definition, all right? So those ones can wait for after, all right? So examples of elective invasive cases, like I've told you, surgical disinfection, but yeah, such things. Yeah.
Now, in the case of risky pregnancies, are there mild remedial medical services or other dental services that can be offered to a pregnant mother?
Sorry, just repeat that question, please.
For the case of risky pregnancies, are there mild remedial dental services that can be offered to care for the oral system of a pregnant mother?
That goes on a case-by-case basis. It depends on the type of risk to the mother, and it depends on what condition we're also treating at the same time. If it's something like, let me use a common example. If your wisdom tooth is aching, all right, and then you have a risky pregnancy, and we know this one can't be removed easily, okay, we can try to manage with pregnancy-safe antibiotics, all right, and painkillers, all right. Of course, at this time, it's always advisable to work with a gynecologist of the patient, and then we will manage it as it is. So the answer to that question, I would say it's usually case by case. Most of the times, we teach you habits to, first of all, we'll give you medication to, of course, manage the symptoms and the condition, and then we will teach you oral habits and care to minimize the chances of it triggering again during your pregnancy.
Thank you so much. Now, we move on to leach calcium. Tell us about pregnancy and leach calcium and how it affects a pregnant woman.
It does not affect a pregnant woman. There's a myth during pregnancy that you get bad teeth due to the baby taking your calcium, and this is a very wrong fact, okay? I don't know if you've ever heard the women who say, I lost this tooth here because of this baby here, and I lost this other because of that. Then they say the common misconception is it's because the baby leached calcium, okay, from the teeth, and that's why the teeth become weak and brittle. This is a myth. It's something we usually say, it's correlation but not causation, all right? It's true that during pregnancy, right, there's an increased demand of calcium because your baby needs a lot of calcium for it to develop its own bones and teeth. Right? It's true the source of that calcium is the mother, so there's an increased source of, an increased requirement for calcium from the mother's body. Right? And it's also true that when there's calcium deficiency, one of the organs affected is the teeth. However, what most people don't realize is because the human body is so well adaptable, you do not need to lose calcium, okay? Rather, the pregnant woman does not need to lose calcium to facilitate the baby's development, okay? There are physiological changes which will happen to adapt to that, all right? And also something we should also know is by the time you're losing teeth, so you're losing your teeth or your teeth are affected by calcium deficiency, that's a very long way down the line, okay? Teeth are affected during pregnancy because of what I said earlier, physiological changes caused by the, and physiological and behavioral changes which create an environment which is good for bacteria to thrive and cause harm.
Thank you. Now tell us about some of the preventive measures that a pregnant mother can adopt to maintain a healthy oral system.
It's basically the same as when you're not pregnant, because you have to brush your teeth, brush and floss your teeth, right? Brush twice a day. Take your time. Don't be in a rush. Don't brush for fresh breath, as I say. Brush like you're taking care of your teeth, okay? Brushing and flossing will help remove plaque and anything stuck in your mouth, which will promote any of this oral conditions. If you vomit, if you're experiencing morning sickness and gastric reflux and so on and whatnot, just a quick rinse after a vomit will help dilute all those acids which are in the mouth, okay? Of course, you can talk to your doctor to help you with your vomiting. I know gynecologists, they know a variety of drugs to help treat that. Yeah, so just rinsing your mouth after vomiting is good enough. You can put a little baking soda because baking soda is a base. It can neutralize the acids in the water. Of course, visit your dentist, okay? If you have regular checkups, go for your regular checkups, okay? If you're there for a clinic, there's a dentist nearby, why not pop in and just have a quick look so that it can help you. And of course, the last one is diet, okay? Make sure your diet is healthy. Eat healthy foods. Try to limit, if you're going to snack, try to limit the sugary foods. Of course, eat foods which will help your baby develop, all right? These are foods rich in calcium, phosphorus, vitamins, and so on and so forth. Yeah, so I think if you do that, you're taking care of yourself well enough to not develop anything.
Thank you, Dr. Sam. Now, we have dwelled so much on maternal. Now, can we hear something about the perinatal? And to start off, tell us about the natal teeth. Are they abnormal?
Yes, of course, they're abnormal because it's an uncommon, anything uncommon.
Someone might be asking themselves what are natal teeth. You know, we're speaking in
okay.
jargon.
Okay, so sometimes, okay, what is normal is the first teeth should appear after about 6 months, between 6 and 10 months. But sometimes, in rare cases, what happens is teeth come out, like you can find a child is born with teeth, okay? That's what we call the natal teeth. Neonatal is when they appear like a month or two after the childbirth, okay? Now that is abnormal, all right? It's uncommon. Anything which is uncommon can be considered abnormal, okay? It's not abnormal in the sense that it's a freak accident, okay? So usually most of the time those teeth are normal milk teeth which just appeared earlier than normal, all right? So they're premature, all right? For a variety of reasons which we can discuss, but we'll be going through technical, but they just appear in the mouth a bit earlier than they should. An odd case or two, they could be what we call supernumerary teeth. That just means extra teeth, okay? Teeth which are not supposed to be. So instead of having the usual 20, you have 22, all right? So sometimes they could be that, but it's more usually that the normal milk teeth come out earlier, all right? The most common ones are the lower jaw, the ones in the middle and the front, okay? What we call the incisors, those are usually the ones which appear. So treatment is, now, usually it's not a bad idea to keep them if they are normal, okay? But if they're interrupting with breastfeeding, if they are hurting the mother during during breastfeeding, if they are hurting the baby, like he's biting on his tongue, then sometimes it's wise to remove them so that their quality of life is not interrupted. But usually we leave them, and the main reason we tend to leave them is because there is always the potential that you could harm the permanent teeth, which usually just sit right beneath the lobe teeth, right? But generally we leave them, and usually they tend to be very mobile and weak, okay, because as I told you, they're premature. So traditionally they just used to be yanked out because it used to be a sign of, I think, wanaita lana or something. So they used to be removed, but it's not, there's no harm in keeping them there.
Now, could a mother's oral health system affect, or rather be a precursor to natal teeth?
No, not that I'm aware of, no.
Yeah, you spoke of myths. So
Uh-huh.
these are things that are myths and misconceptions that actually need to be debunked.
I don't know, I think it's a culture thing, I don't know the type of myths, but they do tend to blame the mother on something they did. But no, it's just a freak occurrence that happens, but it's nothing the mother did, I can say intentionally or unintentionally, or rather maybe it's not been studied that well to know what really causes it to that extent.
Okay. All right, thank you. So teething in babies, how does it affect babies? Some people believe it causes diarrhea, fever, and other ailments.
Now, that is another myth that is out there. A lot of people associate the teething, when teething happens to diarrhea and fever. This is not true, again. It's just another case of a coincidence, okay? One thing is happening, then another thing is happening, so people think, oh, okay, these two must be related, or this is causing this. But like I told you, milk teeth usually appear about 6 to 10 months, all right? Which happens to coincide in something which development of the baby, what people call the oral phase, where children tend to pick things and put them in their mouth, all right? Now, the reason why they pick things and put them in their mouth, who knows? But sometimes they say it's to alleviate the teething, okay? If I could speak about teething can be uncomfortable, all right? Because it does cause a bit of inflammation and irritation, okay? So if it's a new experience for a baby, of course they'll react, okay? So they try to soothe that teething. And they generally tend to put fingers and other things in their mouth, right? But what people don't realize is when they take those things, wherever they take them from, they're introducing bacteria from the environment they've taken them from, and they're putting it in the mouth, which enters the gut, all right? So they're introducing bacteria, okay? It is that which causes the diarrhea, okay? The bacteria from whatever objects are placed in the mouth enter into the gut and cause the harm, okay? Of course, if bacteria start causing an infection, all right, or anything else, or an interruption, you'll get a fever, all right? So it's not that the teething is causing, okay? You can say it's what leads to, but it's not the cause, okay? Teething never causes a fever or diarrhea, all right? Teething is a normal process. It happens to all of us. It happens throughout our life, so why does it only cause diarrhea when you're young? I've not heard of a 16-year-old or 18-year-old who's getting their wisdom teeth complaining, oh, I'm getting diarrhea because of no. Okay, it's just a
So
misconception.
diarrhea and fever in babies could mean some other underlying illnesses.
Usually it's an underlying condition. And also sometimes even that's when weaning starts, if I'm not wrong. So you're also introducing new things which are irritating. Because before that it's used to like breast milk, so you're introducing foods and all these things which the gut is not used to, so it just reacts in a certain kind of way.
Now that the baby depends on the mother's leach calcium to develop, the fetus that is, does a poor health, dental health in a mother in any way affect the unborn baby?
Yes, indirectly, because you see, your diet will change according to your teeth, okay? If you have poor teeth, if you don't take good care of your teeth will not be in the best condition to eat anything and everything which is required, all right? Of course, you can take supplements and whatnot, but you will not be able to eat, let's say, like if you don't have your molars because you've lost them, you'll avoid meat, you'll avoid things like beans and, githeri, maize and beans. You'll avoid those because you can't chew them properly. You'll start relying on softer and softer foods. So you start missing out on certain foods which are rich on certain types of nutrients. So you now start up to overcompensating with other types of food. So yeah, it can, right? I'm not saying that it will, but it can. Yeah.
All right, we would love to go. Now, before we close the discussion, I would like to give our guest today, Dr. Sam Seremala, just a minute to give us his parting shot.
Like I said, the public in Kenya about oral health, which I believe is very important. Still, there's a misconception that it, meno ikinyuma toa, okay? But I believe people should take care of their teeth. Your teeth should last you a lifetime, and if you trust us, we will take good care of your teeth. So that's my potential.
Thank you so much, Dr. Seremala, for that informative session. Now, thank you very much, dear viewer, for making time for Around the Table show. That's it today, and catch you next time, next weekend on Friday, 10:30 for this particular session. Have a blessed Lenten period, and my name is Sasha Elizabeth.